Precision Medicine and the Use of Herceptin by Bryce Catarelli. Objectives: describe precision medicine and its potential application in your practice. Examine the use of targeted therapy for health conditions within oncology and outside cancer treatment. And identify 2 conditions that you will treat in your practice that may benefit from targeted therapy. Precision medicine is the prevention and treatment strategies that take individual variability into account. According to the National Institutes of Health, it's an approach to disease prevention and treatment based off an individual's differences in environment, genes, and lifestyle. It will be utilized to develop the right drug for the right person at the right dose. As this slide demonstrates, the way we metabolize and utilize medications is highly dependent on 2 main factors: our genetic composition and the lifestyle and environment we interact with. We are all slightly different on a genomic level, and medications can be metabolized and/or expressed with a high variability based off that. The same dose is not the most efficacious for every individual prescribed that medication. Precision medicine is an exciting concept for providers in all fields because it can potentially lead to significantly better patient outcomes, including fewer negative side effects or adverse events, and more efficacious and safer prescribing. It is a current focus of a major initiative that has bipartisan support within Congress due to the potential benefits for improved health care. It can be used with all ages, races, and genders. Though versions have been utilized in practice for quite some time in the field of blood typing, its application has been greatly expanded with the development of large-scale biologic databases like the human genome sequence, incredible methods of characterizing patients like genomics, and the advancement of computational tools required for analyzing such large volumes of data. When it is utilized in practice, the results can be astounding. Oncology is the perfect place to implement this approach to medicine. After all, it is a disease of the genome. Research has demonstrated that many cancers have their own genomic signatures. Some are tumor-specific, and some changes can be seen across multiple types of cancers. With this in mind, cancer treatments have been developed as targeted therapies to best treat specific types of cancers based off genetic testing. The National Cancer Institute is focusing precision medicine in 4 ways: using genetic abnormalities of cancer to guide treatment, overcoming drug resistance, and developing new laboratory models for research, and forming a national cancer knowledge database. Targeted therapies differ from traditional chemotherapy, which is cytotoxic, meaning it kills all cancer cells. Targeted treatments block growth and spread at the molecular level on certain genes associated with the cancer alone and not healthy tissue elsewhere in the body. One differentially expressed target, according to the National Cancer Institute, is the human epidermal growth factor receptor 2 protein, commonly referred to as HER2. It is a typical protein involved in natural cell growth, but on the surface of certain cancer cells that is expressed at high levels and is the primary target of a medication called Herceptin. Tumors that overexpress this gene are typically more aggressive and more likely to return after treatment. This medication is approved by the FDA to treat specific types of breast and stomach cancers that overexpress HER2 and has truly become a standard of care after multiple clinical trials demonstrated its effectiveness compared to traditional chemotherapy treatment. It is a type of monoclonal antibody that binds to the surface of HER2-positive cancer cells only in an attempt to kill them. It is administered intravenously to kill active cancer and prevent recurrence. Though it is a targeted therapy, it can still lead to some systemic side effects, including diarrhea, loss of appetite, hot flushes, depression, and joint or muscle pain. Herceptin is often best used in conjunction with chemotherapy so as to prevent resistance among cancer cells. Resistance can occur by the target changing itself through mutation or by the tumor developing new means for achieving growth outside of the target. Studies show that resistance to HER2-targeted therapies is more effectively overcome by using targeting therapies against multiple pathways, demonstrating that the emerging use of precision medicine is still in its infancy, requiring more research and development to create effective personalized therapies. As healthcare moves forward under this emerging field, it will be important to see how you as a healthcare provider can utilize the use of precision medicine in your own practice, whether or not it involves oncology treatment. Many commonly prescribed medications can benefit from pharmacogenetic testing, including Plavix and Coumadin. Barrier to using these tests have been identified as providers not knowing which test to order, insurance coverage, and uncertainty about the clinical value. Resources are being developed to help tackle these concerns so that precision medicine can become a mainstay of treatment across the country. Thank you.